like everything we're going to talk about today, it's complicated. I think to some extent, and something you've mentioned to me before, is that that part of it will be to do with stereotypes. And, we as medical students are taught about the stereotyped patient that might come in with a particular problem. So when a doctor or any member of the public imagines a patient with anorexia, you're probably not typical of that patient. And certainly for a doctor who works with people with eating disorders, they're going to have a much more broad understanding of what a patient looks like who has anorexia. And the trick is that, that's the tricky thing, is that that's not the person you're going to see first. You're going to see someone who is much more of a generalist, whether that's your GP or someone in A&E. And it's about working around the stereotypes that exist about all kinds of different conditions. So I think to some extent there will be a degree of, whether it's subconscious or conscious bias, there will be issues about, you not fitting a stereotype of what a doctor is expecting to see in a person who has a condition like that. But equally, I think one of the things that gets really tricky is the fact that all of these diagnoses in general are associated with a number of really specific criteria. So some diagnoses will be diagnoses of exclusion, where you look for 101 different things, and if you can't find any and you're still left with this constellation of symptoms, then you might say, okay, well, we've excluded all of these other things, so it must be this diagnosis. But for the majority of conditions, and especially conditions where there is a mental health dimension to them, there will be very specific criteria that you have to meet in order to receive a specific diagnosis. And I think that's not something that is maybe very well understood by people who are experiencing these symptoms, because you can have 99.9% of the experiences in common with someone who has a diagnosis of anorexia, for example. But if you don't meet the specific criteria, that might just not be the name that we give it. There might be a subtly different name which you're not familiar with or which doesn't feel right to you. But it doesn't necessarily mean that you're being dismissed or that we're not taking the condition seriously. Obviously there will be some cases where a doctor just thinks that maybe you don't have the thing you think you have. And that does happen sometimes, that people do get caught up on a diagnosis that maybe does explain or would explain some of their symptoms, but maybe you're kind of looking in the wrong direction for the answers. And I think as human beings, we look for patterns. We want answers to things. We see kind of constellations of symptoms, and we try and put them together and find a solution. And sometimes you will be barking up the wrong tree. Mm-hmm. But I think, again, it comes back to listening to that patient's perspective, trying to understand why they feel that diagnosis is appropriate to them, and then seeing if they meet criteria to meet that diagnosis, or if maybe there's something else going on that needs to be explored. And it comes back to that thing of understanding each other's processes, each other's priorities, and just being open-minded to the fact that you both do want to help in general. It sounds like your experience wasn't particularly fruitful, but in general, if you both bear with each other and try to understand each other's motivations, then you will reach a conclusion, and it may not be where either of you thought you'd end up, but it may be the right place when you get there eventually.